much, particularly for minority populations, because we're disproportionately impacted. And then the fewer compatible organs that are available translates into longer waits and probably more dire outcomes for our minority community members. Is that correct?
Most definitely. We match better with a person of our same blood chemistry, even though if I needed a kidney, there is a chance that I might match with a white counterpart, but I more than likely will probably match better with somebody of the same race and everything. So that's the reason why we are actually on the wait list more so than anybody else, because we are actually, there are less people of our same race that are actually signing up to become organ donors.
Yeah.
So that we need more and more people signing up to become organ donors of people of color.
So to our listeners, see how important this is. We just want to encourage you all, educate yourselves, become more informed, and then also become organ, eye, and tissue donors because of how critical this is to our community. Thank you so much for sharing that. Can you talk a little bit about some of the upcoming promotional events that MOTTEP is having?
So one of the programs that we've been doing, especially since the pandemic, is actually going out in the community and encouraging people to increase in confidence in the COVID-19 vaccine and the vaccine. So I'll let Tiffany talk about our programming as far as our vaccine education program. But we're still doing the work of organ, eye, and tissue donation as far as increasing awareness about the importance of organ, eye, and tissue donation. We're participating in the upcoming Minority Men's Health Fair that's going to be held at Metro Health. It was at one time at Cleveland Clinic, but Dr. Charles Motlin is now at Metro Health. You can that up on their website. We are also participating in a lot of events as far as because this month is not only Minority Health Month, but also Donate Life Month. So we are limited to what we're doing this month, of course, because of the pandemic. There's not in-person community events like there used to be. And I'm hoping that next year that we're going to be everywhere. But now we're doing a lot of stuff on our website, which is clevelandmottep.org. So you'll be able to learn more about Donate Life Month, but also Minority Health Month. But there's a lot of Minority Health Month events out there, and we're hoping to actually go to some of those events this month also. But to learn more about, like I said before, about both of those events and about organ, eye, and tissue donation, please visit our actual website, which is clevelandmottep.org. And we also very regularly update our post on Facebook, also at Cleveland MOTTEP.
That's wonderful. Ms. Kimble, you have provided a wealth of information to our listening audience so that we can all become better informed, so that we can address those myths as we hear them in conversations with our families, with our friends, in the workplace, so that we are better educated and better informed. And I just want to thank you for being a part of our show today.
And thank you for allowing me to actually participate today.
Oh, it's my pleasure. And now we have the amazing Miss Tiffany Stately. Now, Miss Stately, you are the Vaccine Education Program Coordinator, handling that very important special program that Miss Kimble alluded to. So can you tell our listening audience about the Vaccine Education Program?
Absolutely. Thank you for having us. Our vaccination program is grant funded. We are grateful for the grant received from the Centers for Disease Control Foundation, as well as the Centers for Dialysis Care Foundation. As Linda said, we are located and housed at CDC East, which is on Stokes Boulevard. Our program targets 2 Cleveland neighborhoods, which is in Huff, zip code 44103. And University Circle 44106, because those 2 communities are affected by COVID-19 deaths the most. As the program coordinator, I schedule our vaccine navigators for outreach programs and vaccination pop-up clinics. And we just have this one-on-one approach where our navigators are trained to have talking points, to talk to our community, to be active listeners, and to build rapport and build that trust, and just beat those myths, as Linda was talking about. We love empowering our community by getting vaccinated. We pass out a lot of information, good information, incentives, and they love our t-shirts. We wear the yellow ones that say "Got the Vax," but thank you. Well, we pass out the white t-shirts because the t-shirts are conversation starters. We want them to wear them in the community and talk to their friends and families. If they see that they're vaccinated, it makes them comfortable to become vaccinated.
Right. And so would you say that there is still some reluctance among our residents within the Cleveland community about getting the vaccine? And would you say that that's impacting Cleveland's vaccination rate?
Yes, Cleveland is still under 50% of a vaccination rate. It's about at 48% that have received their first 2 doses of vaccinations, and the booster shot is at about 22%. So there is still a lot of hesitancy, as well as just that mistrust. They don't even want to talk about it much anymore. We've noticed in our vaccination clinics are slowing down as far as the participants attending them, but we still have more work to do. This pandemic is far from over.
Yes.
I heard this new term that I learned, pandemic fatigue. People, they may be tired of hearing it, but they need to hear the message about 7 times before actually getting it. So that encouraged me to just keep on, because one vaccination at a time. We are approximately at 1,500 residents vaccinated since I've been in this role since October.
Wow.
So one vaccination at a time, one conversation at a time. Sometimes you plant the seed by providing the information and they remember the conversation and they may become vaccinated later.
Good, good. So it's all important. Everything that you're doing is really critical to, as we say in public health, moving the needle on this very important issue. So let me ask you, in your conversations with people, what are some of the top reasons that people are indicating about why they won't get the vaccine?
Oh yeah, we still are hearing the vaccine will make me sick. So we talk a lot about the side effects. I've come from the healthcare environment of working in a hospital for 6 years, 2 of those years being in the pandemic. So I really paint a picture of what an unvaccinated patient looks like in the intensive care unit versus someone that gets our vaccination. They may have mild side effects such as a sore arm, headache, and things that can just really be passed over than someone that's suffering unvaccinated in the intensive care unit. Also, they're still thinking they'll turn into a zombie. We still get that. Oh, no. Even co-workers and family members. So I said, I'm not a zombie. And we've had vaccinations out forever with our children becoming vaccinated, having their vaccinations for school.
So it's nothing new, is what you're saying.
Yeah. And, some of them just have their mind made up and they've actually talked themselves out of it. They'll listen to their friends over their doctor, or if they're not even visiting a physician. It's just really important. That's why building that rapport and having these conversations. I more so do that active listening. I ask them, what are their health do they have underlying health conditions? Who's in the household? Are they living with an elderly parent or grandparent? As Linda stated, high blood pressure, diabetes, dialysis patients, they're at risk. So are you protecting your loved ones by wearing your mask and not bringing that back home, to your family? So, those one-on-one conversations are very powerful. Some of them go into a reactive state. They'll get vaccinated after something has happened, such as a death. Right around Thanksgiving, Christmas, we've seen vaccinations go up because some of them couldn't even go to the holiday dinner unless they got that vaccination. And grandma was not having it.
Right. And sending a clear message that if you're not vaccinated, you're not getting in here.
You're not getting dinner.
It won't. And so for those who still have questions about the safety and effectiveness of the COVID-19 vaccine, or just basically, those kinds of things that you mentioned, where can they go to learn more facts about the whole COVID-19 vaccine process?
Oh, yeah. We have frequently asked questions on COVID-19 at clevelandmottep.org, same website Linda provided. There's also a drop-down menu on our vaccine awareness program. And also, like Linda said, Facebook, we're at Cleveland MOTTEP, MOTTEP, as in Paul.
Okay.
I post local pop-up clinics, whether we're in attendance there or not. I make sure that if it's something going on,